So sex is supposed to be an enjoyable and exciting experience, but sometimes that isn't the reality. In fact, around 10 to 20% of women experience painful sex at some point. And painful sex is common, but it's not normal, and we shouldn't be dismissing it. I'm Brooke, I'm a gynecology doctor, and in this video I want to explore some reasons why you might be finding sex painful, how you can talk to your doctor about it, and what treatments are available to help improve things. Sometimes you can have pain with sex that can be temporary. It can resolve on its own. It might be something that happens because you've got occasional dryness, or you're just feeling tension in your body. In these cases, it's not necessarily a sign that there is something more serious or anything wrong. However, if you do have a recurring pain with sex, or it's impacting on your enjoyment of intimacy, then it's worth discussing with a healthcare provider. Now, even if it is a common experience, painful sex should not be trivialised because there's support and there are effective treatments available to help you to address it and to improve your comfort and ultimately your quality of life. So, how do we know what is happening? Well, to address painful intercourse effectively, we need to work out the specifics of the discomfort, so your doctor's going to ask you to describe your symptoms more specifically. Firstly, they'll want you to describe what type of pain. Is it sharp? Is it a burning pain? Or is it more like a dull ache? Then describe the location. So is it pain that is right at the vaginal entrance, what we call superficial pain, or is it deeper inside? And finally, the timing. So when do you notice that pain? Is it right at the start of penetration? Is it with specific positions? Is it there after you finish having sex? So once you have these answers to these questions in mind, let's think about what the causes could be. Now, there's many causes of painful sex, so let's start with where it is based, and we can talk about the different causes for each location. So firstly, if your pain is more superficial, so it's on the outside. The most common cause of pain with sex is vaginal dryness, because sex is always better when it's wetter, when it's lubricated, and nearly half of women who report pain with sex have also noticed vaginal dryness. If your vagina is as dry as the desert and you try to put something inside it, you're likely to experience a discomfort or even feel like you're getting a friction burn. Now, vaginal dryness is usually associated with a drop in a hormone called estrogen, and that's why you might notice vaginal dryness if you're breastfeeding, or more noticeably around the menopause, because there's a natural drop in the levels of estrogen. If you're experiencing vaginal dryness, it is time to embrace the lube. Using a small amount of lubricant before sex can make that experience more pleasant and less painful. And we shouldn't just be reserving it for people who are postmenopause. Ideally, everyone should be using lubricant for all of their sexual encounters. If you do have a more persistent dryness, so you have it the whole time, not just when you're having sex, then using a vaginal moisturiser regularly can improve the hydration and elasticity of the skin. Vaginal estrogen therapies, which you can have as creams or tablets or rings to replace the estrogen directly into the vagina, are safe and effective. We can use those on a regular basis in someone who has low levels of estrogen and target the estrogen right where it's needed in the vagina, and it doesn't get absorbed that much into the bloodstream. Other than vaginal dryness, there's a number of other reasons why sex can hurt, both during or after the act. Then these are some of the reasons why it might happen. Firstly, infections. That includes thrush, so if you notice a white or a thick discharge, or could be sexually transmitted infections like chlamydia or gonorrhea can give you pain with sex. Next, there are skin conditions like psoriasis or lichen sclerosis, or some people have a specific allergy in the skin of the vulva to things like latex condoms, soap products, or spermicides. So if you notice a redness or a soreness in the skin as well as pain with sex, that could indicate a skin condition. Then there's vulvodynia. This is a chronic pain condition, and that means you get a burning or a stinging or an irritation of the vulva that can be triggered by activities like sexual intercourse, or even just sitting for a long period of time or wearing tight clothes. It can just all cause this severe pain in the vulva. That's vulvodynia. The exact cause isn't well understood. It could be because of nerve issues, it could be hormonal changes, or related to past trauma. And then there's vaginismus, but I'm going to come back to that. So what happens if you feel pain within your entire pelvis? Well, if your pain is on deeper penetration, or it's felt in your pelvis or your abdomen rather than just your vagina, then there are other conditions that it could cause, but it's most likely that there's conditions that involve your uterus or your bowel. Now, whilst these conditions can cause pain during sex, they often have other telltale signs to help us to work out that they're there. So for example, if your pain that is during sex is coming from your pelvis, it could be caused by conditions like endometriosis, fibroids, ovarian cysts, adenomyosis, adhesion, so scar tissue if you've had previous pelvic surgery, or pelvic inflammatory disease, again infections that cause severe scar tissue within your pelvis can cause pain with sex. And then there's other things like constipation, IBS, or psychological conditions. So vaginismus is a mind-body response to a fear of vaginal penetration. Your vaginal muscles tighten involuntarily when you have a small amount of vaginal penetration, making penetration impossible or really difficult and painful. It can prevent penetration because ultimately your pelvic floor muscles just clamp down tightly. It can feel like they become a wall. And that causes pain, which can feel as sharp as razor blades inside the vagina. Now, vaginismus has other symptoms, but it might mean that you cannot have penetrative sex at all, or you cannot insert a tampon at all. You might have a fear of the pain or fear of having sex at all, and you're likely to lose your sexual desire. For women with vaginismus, the debilitating symptoms can happen right at the start of puberty, for example, when they first try to insert a tampon, or it could happen with the first experience of sex, which might be really painful. Those can trigger primary vaginismus. But vaginismus can also occur after you've had a normal vaginal function for many years. This is called secondary vaginismus. Vaginismus can happen intermittently. It might be in certain contexts with certain partners or certain circumstances. So it is something that can come and go throughout your lifetime. It is not a lifelong diagnosis necessarily. There are many potential triggers that can lead to vaginismus. So it might be that you've had a previous experience of sexual trauma, or you could have had other vaginal trauma like childbirth. You might be someone who's had urinary or vaginal infections and that pain has triggered this vaginismus. You might be suffering from stress, anxiety. You might be living in an area where there's cultural stigma or embarrassment associated with sex. It just makes you really fearful of it. You might have issues surrounding your body image. So ultimately, what should you do if you experience pain with sex? As I said, it should be an enjoyable experience. It's an important part of a relationship and you shouldn't have to suffer through it. So if you're having pain every time you have sex, ring your GP or a healthcare professional. They can check you over, they can recommend some treatment options depending on your symptoms and what the most likely cause is. So to help your medical team and yourself to work out what could be going on, we're going to ask you some of those questions I mentioned above. The kind of pain that you're experiencing, where it's coming from, and when it occurs. Now these questions can help to determine the most likely cause because a stabbing deep pain might be suggestive of endometriosis, whereas a burning superficial pain is more likely to represent vaginismus. Then depending on the cause of your pain, your doctor could suggest medications if they think you have an infection. They may recommend vaginal lubricants and moisturizers, or they might tell you to stop using fragrance body care products if they think that there's a skin reaction. They may recommend a form of estrogen replacement if you've got vaginal dryness, or treatment for the emotional issues at the root of the problem if you suffer with vaginismus. And also, if your pain relates to vaginismus, the treatment may involve being referred to a psychosexual therapist or a pelvic health physiotherapist. Ultimately, there's loads of things that can help you to improve painful sex. First, we need to rule out any underlying medical cause. Book in an appointment with your GP or a sexual health clinic. You should not be embarrassed to talk about sex because remember that doctors and other healthcare professionals are used to dealing with these types of concerns. And the more openly you speak, the better they can help you. Your painful sex could be a sign of endometriosis or an infection or a skin condition, but you can't know and you can't get the treatment you need until you go and speak to someone. Next, track your periods. Make sure you document your periods in an app or a calendar so you can keep track of when you're bleeding and also when you're experiencing this pain. It can help you to identify if you do experience the pain at a particular time in your cycle. Third, switch up your sex life because with new positions, new lubes, new toys, exploring new things, you might be able to find some better and wetter positions that can feel more comfortable. Nobody should need a reason to use lubricant. It should be part of everyone's routine practice for any type of sex. But you might also find that adding in more time spent on foreplay or different positions can help increase arousal, reduce tension, and ultimately improve your pain. Next, go easy on yourself. Sex is supposed to be fun, and there can be a lot of pressure to pretend that you're okay if you're experiencing pain. You cannot force yourself to have a good time, and it's important to be honest with your partner about what you're going through. Communication is key here, and knowing your partner is on the same page can help you to explore at your own pace what feels right and what isn't working for you. And sometimes you might need to take penetration off the table completely, and that can allow you to enjoy an intimate experience with your partner without feeling stressed or pressurized. And by communicating well and gradually exploring your bodies without worrying about penetration as the end goal can allow you to enjoy the intimacy of sex in different forms. But above all, remember, pain is not something that you just have to accept. The sooner you open up the conversation, the sooner you can get some help and get back to enjoying intimate moments rather than avoiding them. So let me know if there's anything else that you wanted to know about painful sex below.